Hallucinations are one of the most challenging symptoms of schizophrenia for both the person experiencing them and their caregivers. Let's say your loved one tells you there's someone in the room, but there is no one there, or they are convinced that a stranger is following them wherever they go. It can be confusing and frustrating for you, but in their mind, this feels absolutely real. So, how can you help them differentiate between reality and the hallucination? That's what we are going to talk about today. Understanding hallucinations. Hallucinations comes in different forms. For some, it's visual hallucinations. For example, they may see a historical figure standing in their room as if that person is real. Some experience auditory hallucinations where they hear voices telling them to do things, something dangerous like jump off the balcony. And some people experience tactile hallucinations. They might feel like insects are crawling on their skin even though there's nothing there. Now, you can't see what they are seeing, but for people struggling with schizophrenia, these hallucinations feel absolutely real. It feels as if they are genuinely experiencing these things. So you can't just say that's not true or you're just imagining things. Saying this will break their trust. They'll feel misunderstood, and that makes it harder for them to accept help. Communication without confrontation. So, the right approach is to help your loved one without confronting them or invalidating their experience. You can try a few different techniques. Start by validating what they are going through. Like, I understand you're seeing something right now. It must feel very real to you, and I'm right here with you, and you're safe. This builds trust and shows them that you are on their side. Then, gently challenge without confrontation. Be sensitive to their feelings and question their perceptions. For example, if they say there is someone standing there, you could respond with, do you think anyone else can see them? Can we go together and check? This approach allows them to explore their perception with you rather than feeling attacked or dismissed. What if they are stuck in their hallucination? For example, they insist that insects are crawling on their skin. In such situations, try to gently shift their attention. Like you can take them for a walk or ask them to describe their surroundings. Ask them like, can you just feel the texture of this pillow? This brings them back to the present moment. You can also guide them through breathing exercises like let's take a deep breath together, inhale and exhale slowly. This helps distract their senses and ground them into reality. Another technique that can help a lot is pattern journaling. Encourage your loved one to write down their thoughts or emotions when they experience a hallucination. This helps them identify triggers. For example, they may notice that hallucination happens more frequently when they are stressed or haven't slept well. And by identifying these patterns, they can develop coping strategies for the future. As caregivers, there will be moments when everything feels overwhelming, and sometimes the emotional attachment can lead to frustration. You may find yourself thinking like, why aren't they listening to me? This is very natural. This is where therapists come in. Professionals, they use tools like reality testing exercises and structured therapy sessions, which are designed to help manage these symptoms in a safe environment. It's okay to lean on professionals. Involving them will make the journey much smoother for both you and your loved one. And remember, you're not alone in this journey. Take care.